Natural disasters that strike vulnerable areas can face many challenges when attempting to maintain proper hygiene, especially when it comes to hand washing. Hand washing is the most important when preparing food, before eating, after using the toilet, and coming into contact with patients in a hospital setting. Inadequate hand washing can lead to various health implications such as diarrheal morbidity, increased sickness, foodborne illness, and the spread of infectious diseases during a disaster. Hand washing also decreases the prevalence of acute respiratory infections and pneumonia. Natural disasters often cause conditions where there is low volumes of water usage and insufficient hand washing. This can lead to water-scarce infections. This increases the chance of fecal contamination. Research showed that 64% of cases where transmission of fecal matter to food or mouth happened through hand contamination. Fecal matter ingestion can cause typhoid fever and transmission of diarrheal-causing pathogens, which could lead to diarrheal morbidity. The fecal oral pathogens include viruses such as hepatitis A or protozoa such as Entamoeba histolytica or Cryptosporidium, which is pictured on the right. Some chemical contaminants include biofilms, which are coatings of organic and inorganic materials on water pipes that can end up in the water. Biofilms can cause the propagation of bacterial pathogens, such as leptospira, that can be transmitted by contact with skin. Leptospirosis epidemics have been seen after heavy floods and hurricanes. Biofilm can lead to leptospirosis, which can lead to diarrheal rashes, high fever, headache, and chills. Hepatitis A can cause abdominal pain and impair liver function, which can lead to dark urine and yellowing of the skin. Areas that are vulnerable to flooding or have inadequate sanitation can have an increased chance of becoming exposed to these microbial and chemical contaminants. Hurricane Katrina caused a huge flooding problem in August of 2005. Hurricane Katrina wreaked havoc in the Gulf Coast region, causing issues such as overcrowding and displacement of families. Some vulnerable populations that were heavily impacted by Hurricane Katrina included hospitalized patients, people with chronic illnesses, and African Americans who were low income and poorly educated. A large portion of these populations chose not to evacuate or were not properly informed about the evacuation. Those who chose not to evacuate came into close contact with the floodwater and used contaminated water to wash their hands. Many evacuation centers and shelters did not have an adequate amount of fresh water supply. This led to a decreased amount of hand washing. Improper hand washing after natural disasters can lead to sickness and disease. However, there are solutions to this issue. One solution is educating the victims of natural disasters about the importance of hand washing and how to properly wash your hands. The following is a video showing just that.
Before starting to wash your hands, make sure to remove all jewelry, bracelets, watches, or rings. After that, you can follow 5 simple steps to proper hand washing. The first step is to wet your hands with clean running water, warm or cold, turn off the tap, and apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the back of your hands, in between your fingers, and under your fingernails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from the beginning to end twice. Rinse your hands well under clean running water. Be sure to remove all soap, dirt, and grime. Dry your hands using a clean towel. Make sure to remove all the remaining water off of your hands. Good job.
Two main types of soaps are antimicrobial soap and regular soap. Antimicrobial soap usually includes antibacterial ingredients such as triclosan. It is effective in hospital settings where there are patients with weak immune systems. One con of antimicrobial soap is that it can reduce the healthy bacteria found on the skin, which can increase the prevalence of superbugs, which can become resistant to antibiotics. Regular soap has been found to be just as effective as antimicrobial soap, according to CDC. This may be the best choice for maintaining sanitation resources after a disaster. Sometimes clean water is not available after the event of a disaster. If soap and clean water is not available, then alcohol-based hand sanitizers can be used to remove contaminants following these simple directions. 1. Apply the gel to the palm of one hand. 2. Rub your hands together. 3. Rub the gel all over the surfaces of your hands and fingers until your hands are dry. The last solution that can be implemented is making improvements to the emergency preparedness plan. It would be beneficial to increase the amount of hand washing stations to promote hand washing among medical staff in between treating patients at hospitals. Families and volunteers should be told to use hand sanitizer when clean water and soap are not available. The evacuation centers should have multiple water containers and soap that are properly maintained. Individuals who have come into contact with floodwater should immediately change out of clothes that have been contaminated. Hygiene education could help these impacted communities immensely in improving conditions and decreasing health impacts.